So we're here at Hummingbird Place, which is located at 887 Perturo Avenue on the grounds of San Francisco General Hospital. And let me take you inside. It's where the clients have the day treatment. And we've got the day dropping clients. This is where they come in. A lot of the clients hang out here. This is where we hold the morning meetings. As you see, our dining room, and all around is all bedrooms. So there's 2-3 people per room, but they all have their privacy, and there's the staff office. Right now during COVID world, because of the social distancing, we also use the living room where people can sit and have their meal just to spread folks out. We don't have a cooking facility, but this is our kitchen, and we try to be creative with what we do for the meals for clients. Back here, there's offices. And I'll show this. The laundry room, which is a big deal. This is, especially if you're homeless, this is such a big deal, and it goes all days. Especially when we had the day dropping clients, it's like nonstop. I'm impressed with these machines. Our handicapped shower. This is what we call the TB room, or we use sometimes as the isolation room, but a lot of times we get referrals from the TB clinic. Clients have gone through their treatment and no longer contagious come here because they have their own restroom and they're right close to the clinic, and so they continue in treatment. This is our med room. We hold medications for client safety, but they're responsible to take their own medications, and staff does monitor them and work closely with the providers, and of course with our nurse and our doctor. Clients will come in here and just sit on the chair, same thing, do artwork, read, watch movies, do nothing.
A little bit. I mean, I think we're very proud at PRC about what's really unique about Hummingbird. Can you share with the audience a little bit about the philosophy of care here and what makes it unique as a navigation center and as a part of the behavioral health system in the city?
What makes it unique is that the clients that we serve, I mean, these are the clients of the lowest, high users of the psychiatric emergency services, the emergency department, and clients that are still in contemplative state. And that, you know, the fact I say many times, if clients walk in the door, it's a big deal. And rather, we've had clients that over the years were going to psychiatric emergency, if not every day, at least a few times a week. And those folks, many of them have come up here and made it successfully, moved on. Or we've had people that rather than showing up at PES, they just come straight to our door, and we've done emergency overnight. The advantage of Hummingbird is that the flexibility is different. If you're not ready for treatment, you do a group Monday through Friday, 9 a.m., that's mandatory, but you can come in here and say, I just need to get some rest. I just want to do my laundry. I just want to eat. I need my ID. And I say that ID over and over again because it is a big deal. It's things that we take for granted, but without an ID, you can't do anything. And Hummingbird also allows you, you can homeless, dealing with mental health issues, dealing with substance abuse issues, dealing with medical issues, and you can come in here and still address whichever of those issues you want. And then, just get your life a little bit together and decide, I'm gonna leave, I can leave whenever I want. But if I know in a few days if I want to come back, I want to come back. The street people, or the psychiatric people, or the drug abusers, whatever people want to call them, come in here and they do their thing and get it together. Again, even if it's for 48 hours a week or two, it's 48 hours or a week or two that they are not on the streets.
Yeah, and we talk about this as one of our shining star programs at PRC, right? And there's a lot to be proud of, and you have directed all of it, right? It's from inception and partnering with John, certainly, but really conceiving of the program and then successfully growing it. And I think certainly with the city, it's seen as a Shining Star program, and with us, it's the first stop along a continuum of care provided by PRC, right?
Yes.
From here to 30, 60-day, 90-day treatment programs to eventually help with wraparound services and hopefully moving on to supportive housing for some of those clients, right?
Yeah.
So this is first stop, and it's a great first stop. I guess my last, sort of final question is, when you think about all of this, what do you think's been the most meaningful part of your work here to date?
The fact that we were able to open up this program and the success it has. There's a lot of people that, like a lot of clients, I'll say, that really dislike us, and there's a lot of clients that love us. But at the end of the day, even the ones that dislike us will come back. And so the fact that people have been allowed to test and know that it's a safe place, because like I said, we've been called all kinds of names, especially with the day clients and people that normally would be perceived as aggressive, have been able to find different ways to communicate. But for me, like I always say, in my years of working in the system, I'm humbled by the clients. I'm humbled by their experience. I wouldn't be able to do what they do. I wouldn't. I would be clear. I would have not made it. I'm fortunate that I have the family and friends I do, but I'm humbled by that, and I'm humbled that they allow us to engage with them. They allow us to, that they trust us. And so, but this program is unique just because of the flexibility, and you can really be who you want to be. Like, you can come in here, you can have your pet. We're not even going to screen, do you have, like I'll ask, do they have the rabies shot and that, but other than that, it's like, no, there's no other requirements. If you're a couple, you can come in here with your partner, and so, and we've had that, and we treat them as individuals, but they're coming in here as a couple. And so that, again, that's what, the flexibility and the low threshold of Hummingbird, that's what makes it successful.
Thank you, that was great you said. Thanks so much for taking time to talk to me today. I really appreciate it. And I know our viewers are going to really be excited to hear what you have to say. So thank you. Thank you.